Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Time again for our weekly update. So we are now 2 weeks past gatherings at Easter and 1 week past the end of spring break. Some areas are seeing a spike. Here in Haywood County, we have seen an increase in cases and hospitalizations, but we may not be seeing as big a surge as others yet. 1 more week, though, and we'll know more. So please share this video with someone you care about. Around the country, some areas are seeing a spike just like the previous surges. 15 states now in the red. That's an increase from 12 last week. And note the same areas in red as last week, and more of Florida now in the red. Our neighboring states flat this week. Each remains in the orange. Adjacent counties in Tennessee are in the orange, and in Georgia, those adjacent counties are mostly in the yellow. South Carolina, note the counties next to us that were almost all in the red are now almost all out of the red. North Carolina, continued increases in cases, hospitalizations, and now deaths this week. 12 counties in the red, and there were 12 last week, but 2 of those are now in western North Carolina. 22 counties in the yellow last week, 15 this week, and 3 of those are in western North Carolina. For us, the big move up has been in Macon County, now well into the red, joining Transylvania, who remains in the red. Now these two have 2 of the 5 highest rates in the state. Henderson with a significant increase but remains in the orange. Madison and Jackson with significant decreases. Jackson now down into the yellow, joining Swain and Graham, who have 2 of the lowest rates in the state this week. As far as testing, North Carolina is back above the 5% threshold. Haywood County reached as high as 10% briefly this week but ends the week at 8%. Jackson up above 5% even as their cases have dropped, which would suggest that they're not testing enough. But note everyone reporting saw a higher test positivity rate this week, and most above 5%. As of Friday in Haywood County, total cases for the pandemic, 4,185. That's an increase of 59 over the past week. We reached as high as an increase of 79 on Wednesday compared to its previous 7 days. And interestingly, the school system reported 4 cases this week in their first week back from spring break. So could this represent the peak of the spike for us? We'll see. For comparison, this week Michigan saw 47,000 new cases and 342 deaths. Their test positivity is at 18%. And people between 20 and 40 have the highest rates in Michigan. In fact, 5,500 new cases per day in these ages in the past week alone. And many more of these are ending up in the ICU. The question is whether the significant increases seen in some parts of the country, like Michigan, spread to other areas, like us, as we have seen happen in previous surges. Will enough people travel elsewhere so that other places just see a delay in their spike? But if, in fact, we in Haywood County have seen the peak of this current surge, that would set us up well for summer and fall. But let's be honest, despite vaccinations reaching significant numbers now, cases continue and deaths continue. Of our cases in Haywood County in the past week, 75% are between the ages of 20 and 60. That's an increase. 40% have a known exposure, mostly family, and 1 out of 6 have an unknown exposure. That's an increase too. But even a more concerned, 45% of the positives this week, either we were unable to reach or refused to share information with us. Now, if those folks are isolating and notifying their close contacts to quarantine and get tested, thank you. But if not, that choice just prolongs this pandemic for everyone, prolongs the time until we can all safely gather together again. So if you've not gotten vaccinated, please don't confuse your risk with the markedly reduced risk of those who are fully vaccinated. Your risk has not changed. You are still at risk for disrupting your life by getting infected or exposed, for getting those you care about sick, for hospitalization and even worse, for being in the 1 out of 3 estimated to get long COVID, prolonged symptoms that start as a milder illness but just don't go away. There's your risk. So be well and be careful, especially right now.